So I know that you guys really focus a lot on the education piece, but you also really measure data for employee satisfaction and you really measure employee engagement. Can you explain a little bit more on what you guys do with that data and how you measure it?
Yeah, we think about a trust model, and the trust model consists of 5 factors, but it really comes down to a few. So when you think about your workforce, it's credibility, respect, fairness, pride, and camaraderie, and that really cultivates a positive employment experience. Some of those are towards your colleagues, some of them are the work you do, so taking pride in the work you do, or celebrating with your colleagues. And some of it is items that us as leaders of business have to provide, whether that's credibility or fairness. When it really comes down to it, I think about it 3 pillars. If you walk into any meeting with someone on your team, you should ask yourself these 3 things. Do they have the authority, the autonomy, and the tools to do the job? I think those are the most important things that you focus on. And as we've learned over the years of millions of surveys with employees and millions of data points, those are the 3 questions you can ask yourself. And if they're positive questions and answers that come from that, then you're going to have a really good employment experience.
Nice. Yeah, absolutely. So I'm going to shift gears just a little bit. I know that Salesforce has been a great tool for your company. And can you explain the different ways that you guys are utilizing Salesforce right now?
Yeah, we're a data business, so we've got to be data driven ourselves and think about what we do as a metric-based leadership team. And so, we think a lot about the winning by design framework, which is results, effort, knowledge, and skills. And so we use that internally. And Salesforce is that engine, whether it's CPQ or customer data, renewal data, even some of our product utilization data, we pump back into Salesforce. So it's our hub. We live and die by the data that's pumped out of Salesforce.
Nice. So I know that you guys use Salesforce to help distribute training courses. And correct me if I'm wrong, but weren't you guys the first org to publish COVID-19 education for people?
Yeah, it was definitely an interesting time. So I'll wind us back. It's a fun story. But we had just acquired an organization that provided training. I was getting ready to fly out to that business. It was based in North Carolina, and COVID hit. So talk about an interesting time to acquire an organization and have to have it transition out. But ultimately, what we found was the world shut down, as we all know it. And we went into kind of fast action response and took a lot of the guidelines from CMS and published a training. And it was the first one on the marketplace and had a lot of critical information that helped frontline direct care workers navigate essentially COVID-19 for the next 2 years, really.
Wow, that's so great. So when did you guys decide that Salesforce was going to be the CRM or your ecosystem moving forward?
I think we decide that every day. It's an evolving process, but I think we really got serious about it probably 12 months ago, 18 months ago, when I'd say we outgrew our previous CRM and just ultimately ran into limitations around how we wanted it to drive the business versus just how we wanted it to collect data. So that was a transformative time for us, but we're constantly working on it. I think it's an evergreen process.
Yeah. Definitely. What can we do for you? And I'm speaking for myself and the people watching. What can we do to help your company in some way?
Yeah, we'll always take social recognition. We're hiring like crazy. So if you're in the job market and you want to work a meaningful career at an organization that truly cares, that's a great place. You can support us. Outside of that, next time you're in a care setting and a caregiver, a nurse, a clinician walks in, thank them, because they're dealing with a lot of different emotional settings at the same time while trying to provide your loved one with the best care. So that's the number one thing I would say is look up and say thanks to those around you.
Yeah, definitely. I definitely agree. They do a lot of work that a lot of people, they don't really realize that working with other individuals is a calling. And so that it's not easy. So what is next for you guys? Where do you guys see yourself in the next 12 months?
Yeah, I think we're continuing to be inquisitive. How do we bring products to the market that improve patient and employee experience in post-acute care and long-term care? And so we want to be an innovator in our space and continually bring the right tools and solutions to the healthcare ecosystem. I think ties back to our mission, right? Insights, training, and tools to meaningfully improve care experience. I think we're staying on that track.
Yeah, definitely. Well, Todd, thank you so much for joining us today. I really appreciate you taking the time to jump on here and talk to us a little bit more about what you guys are doing.
Yeah, thank you for bringing us on, and thanks for all the work that you do in the Salesforce ecosystem too. Businesses couldn't do it without you.
Yeah, I appreciate that. Thank you. All right, we'll see you later.
Okay, see you soon.